Hi, I'm JC, the NP. Welcome to another video. Today we're going to talk about the DNP, or the Doctor of Nursing Practice, and should the title doctor be used by the Doctor of Nursing Practice in a clinical setting? The short answer is no. And the reason for that is the DNP is not a clinical doctorate. By definition, the clinical doctorate prepares students with clinical competencies to practice in a clinical setting and sit for licensure. The DNP does not do that. Unfortunately, nursing right now does not have a clinical doctorate. The AACN, or the American Association of Colleges of Nurses, even put out a position statement on the DNP. And in that position statement, they even say not to use the term clinical when describing the DNP. Now, this is tough to understand for some people because, as nurses, academia has been pushing the DNP onto nurse practitioners. Well, if you look at the National Organization of Nurse Practitioner Faculty, or NOMF, they are pushing the DNP as the clinical endpoint, and they have been for years. Okay. Now, understand the DNP was initially put in place to provide more doctorates in nursing because prior to that, nurse practitioners and CRNAs and midwives were chewing up all the advanced practice nurses, or all the nurses who were advancing beyond the baccalaureate level. And we were losing the number of PhDs that we needed in order to keep educators in the field. So the DNP was come up with, and it was intended to be clinical. However, the reality is it is not. So part of the initial goals of the DNP was to increase the number of doctorally prepared nurses. That was successful. The other goal was to create a clinical doctorate in nursing, and that was unsuccessful. The DNP is not clinical by definition, okay? However, our academics and NOMF continue to push this. And if you do a deep dive in the literature, which I did, there is no clinical benefit to the DNP. So, if there's no clinical benefit to the DNP, why on earth is academia pushing for the DNP to be the endpoint or the entry-level practice for the NP? Okay, that's a really good question. We'll come back to it though. Okay, so what we look at when we look at this is we have academia trying to get everyone at the doctoral level, even though the doctorate that they're pushing is not beneficial in a clinical setting. It doesn't make sense for the endpoint for a clinical doctorate at all to me. So what we need is an actual true clinical doctorate in nursing, which we do not have at this point. So the long answer is no, the DNP should not use the title doctor in a clinical setting because it is not a clinical doctorate. So by using the title doctor in a clinical setting, you are either intentionally misleading someone or just being unethical. And either way, that's just not appropriate for the profession, okay? Now, back to academia. Why are they pushing the DNP as a clinical endpoint? Well, doctoral credits cost a lot more than master's level credits. We've already talked about the literature not showing the DNP is beneficial at all, so why on earth would they? All right, if you have any other questions, hit me up. You know the drill, jcdnp@yahoo.com, or leave a question in the comments. Talk to y'all later.